Thank you, Brian. We are here today as individuals and groups to call attention to Issue 3 and specifically the dangerous impacts that we believe Issue 3 will have on Ohioans if it does pass. Issue 3 is a very extreme constitutional amendment that, as Brian said, is fatally flawed, is going to result, if passed, in endless litigation, and at best will freeze Ohio healthcare laws in place. As more and more people read the actual language of Issue 3 and more groups look at what it does, they are also coming to this conclusion. And I think that's why you see today the list of the many endorsers and also the co-chairs who have lent their name to this effort. Initially, Issue 3 was being represented as a vote to repeal the individual mandate. But the consensus has grown that it will not affect the individual mandate federally at all, and that decision will be left to the Supreme Court. And it was particularly interesting. Just last week, our Attorney General here in Ohio, Mike DeWine, was quoted in the Toledo Blade saying that if you have a decision of the Supreme Court of the United States of America that validates the Obama healthcare law, I'm not sure how passage of this act would roll that back based on the supremacy clause. So again, across the board, there's a very well-documented consensus that this is not going to have an impact on the federal law. But we can't be complacent and stop there and say, oh, because it doesn't have an impact on the federal law, we're not going to pay attention to Issue 3. Because Issue 3 was written to have an extreme impact on state and local laws as well. And again, these are state and local laws and even rules that many of them were passed in a bipartisan manner that are designed to ensure public health protections, designed to ensure consumer protections. And last month, my organization, Innovation Ohio, teamed up with the two professors that you see here today, Professor Hill and Professor Melman from Case Western Law School. And we did a report, and we entitled it Bad Medicine, to look at the actual effects of Issue 3. And if Issue 3 passed, what would Ohio look like? And the conclusions in that report that you can find both in your packet and on the Innovation Ohio website, as well as the Vote No Issue 3 website, they were very clear and should be of concern to people who are reading Issue 3 and thinking about what Ohio looks like after Issue 3. First of all, Issue 3 says that no state or local law can compel an employer or an individual to participate in a healthcare system. And then healthcare system it goes on to define healthcare system very broadly, including health information technology. So what does that mean for Ohio? It means that court rules and custody battles regarding if a parent has to cover a child, that those would be put into doubt and quite frankly could be unconstitutional. Covering college students, that requirement could now be unconstitutional. The recent pill mill legislation passed again in a bipartisan manner to crack down on pill mills. That could also become constitutional. Things as basic as local levies and school immunizations and disease tracking could be put into jeopardy. And there are some of these laws that are on the books now, and some of these rules that are on the books now that will be put into question, and certainly going forward, trying to amend and improve our healthcare system, amending these laws would certainly be put into jeopardy as well. And then another very significant part of Issue 3 is that you cannot prohibit the sale of healthcare or health insurance. So what does that mean? Well, the report found that meant that, for example, insurance company standards could be put into jeopardy, again, especially going forward. But there are some insurance licensing that has passed since March 2010, which is the exemption in this constitutional amendment. There are also things that the state of Ohio has, again, passed in a bipartisan manner that we require insurances to cover. For example, just a couple of years ago, the state of Ohio required cancer treatments to be covered by insurance plans offered here in Ohio. If we were to do things like that in the future, they very well could be considered unconstitutional. Also, Ohio is doing some pretty significant reforms around health information technology and electronic medical records. This language calls all of those reforms that Ohio is doing into question. And if anyone had any doubt that these were going to be the consequences, after the report came out and the authors of the constitutional language said that the analysis in bad medicine was, quote, not far off, no one should have any doubt anymore. They have validated that this was intended to go far beyond federal health care reform and affect Ohio laws and rules. So in the days since that report and since the authors of Issue 3 validated that they meant for this to be as far-reaching as state and local laws, other people have been looking at Issue 3. And they've been drawing some of the same conclusions that we have in the report. So not only the endorsers that Brian talked about, the co-chairs that are with us today, but also recently the Columbus Dispatch, just on Friday, came out with an editorial that said vote no on 3. And they raised the issue of could we need to go back to the Constitution every time we wanted to change our health care laws? And if so, that would be very, very problematic to move our health care system in Ohio forward. Also, just this week in the Akron Beacon Journal editorialized for a no vote on Issue 3, and also raising a concern that it would hamper Ohioans' ability to improve the quality of our healthcare system. So we are proud to be joined by the groups that have lent their name to the Vote No on 3 effort. We are privileged to have the co-chairs here with us today. Again, everyone concluding that this is going to result in costly litigation, allow bad actors to come into Ohio, empower insurance companies, tying our hands for reforms. And we'd like to share from the perspective of the attorneys who did, and the law professors who did the report with us. They'd like to share a little bit about what they looked at. And then also in a few moments, we're going to be joined by a doctor who is going to be talking about the concerns of Issue 3 as he sees it from a healthcare provider.